My name is Professor Arif Harekar, and I'm basically a child and adult neurologist. And I've been practicing and teaching for almost like 4 decades. There are a lot of conditions, there are a lot of disorders in children that we need to address, but some of them are more difficult than others. The most difficult disease or disorder that I've encountered in my 40 years of practice is autism or autism spectrum disorder. And this is very, very important because these neurodevelopmental disorders, they cause delay in the development. And so what really happens is the basic skills and functions are affected, and we have not normally socialize and communicate. So autism, Asperger's syndrome, childhood disintegrative disorder, and an unspecified form of pervasive developmental disorder. These are all interlinked with each other. And they do autism, so broadly the autism spectrum disorder. Coming to the pervasive developmental disorder, this has been classified way back in 2013. And the name changed after that. And now it is a different term altogether. It is autism spectrum disorder. Now there are lots of important things that one needs to understand. But I keep on seeing these patients, and there are lots of questions the parents keep on asking, and some of them are actually difficult ones. What has happened to my child? How did he got that? So who are the children who are mostly affected? Children who are mostly affected are those that have a developmental delay, are born premature, have a family history of the disease, the parents are at an older age when the child was born. Then there are syndromic disorders in that child, which may make the child more prone to autism, autistic disorders. Of course, this is a genetic disorder, and it is coming in from birth. So coming to recognizing these, it's very important how the parents can recognize. Because if the parents cannot recognize this disorder, what really will happen is that a child will come in late. The child will come in late, the treatment options that we have will all be instituted late. That's where the problem lies. How do we really get the child to come in? It's very important. So we need to first know if the child had only conditions that are mentioned. Now, if it's the first child that the mother had difficulty in recognizing it, but there are parents who have already had 4 or 5 children, and they will know the milestones. So when we're talking of autism, we're talking of the mental milestone. We're not even talking of the physical milestone. The most important mental milestone is potty training, non-academic age. But if you look at a child, and if you see a similar child at the age of 6 months, 9 months, you will see that this child is little more evolved, interacts with themselves, like interacts, and they do not intermingle with children. They do not play with the kids. That is where the problem lies. So recognizing these children early will help us to start treatment early in life, and the end result would be better. Because this is a growing brain, and when you come into the growing brain, you must apply your treatment as early as possible before any sort of damage has been done. Coming to the milestones, that's the normal child and start recognizing mother at 6 months of age, will look around with some of these children will over things, will grab things, will recognize mostly mothers and fathers, and then will start to recognize the environment. So the autism disorder is more of a cutoff from the surrounding or the environment. So if a child is growing up, is communicating with the environment, is sort of playing himself, but being attracted by children, then the chances of him or her having autism are much less. So their contact with the surrounding is extremely important. These are very, very important points that one needs to register. Early recognition, the milestone, the awareness, the parents must be trained. So that is why we have the awareness program. This very program has the same implication, has the same cause, and has the same purpose that this is not only for doctors, young doctors, and senior doctors, it is for the parents and the tenant who are actually involved in the upbringing of the children. This is very, very important, really important. The mother recognizes the child, and when most of these children that are actually brought to us at 1.5 years of age, at 2 years of age, a normal child should attain this most important mental mastery. So these things are very, very important. So not all children are hyperactive. Not all children are hyperactive. Autism alone can be seen in children. Coming to the treatment options are many. There are no real medications, but there are medications for hyperactive or the ADHD element of autism spectrum disorder. But autism itself needs behavioral therapy. There are lots of therapy so that to improve the child's contact or connection with the environment. Either behavioral therapy, either cognitive therapies, and there are many of them. There are two other important ones that one needs to state here. One is the verbal and the non-verbal. That the child also has speech delay. The child that has speech delay, they are definitely more. So if you have such a thing, then you will need both the help of a speech therapist and behavioral therapist, and therapists who are working on autistic children. We have to have a combination of both. Of course, someone who is verbal and someone who is non-verbal is the proper person's child can speak. You do not even have to worry about it. If they cannot speak, you need speech therapy, which will be as important as treating autism. So coming to the end, I would like to tell you that if the child is diagnosed early, things can be better. And recognizing the autistic child may be often very difficult because there are certain children who have a very mild form of autism. They're slightly off the track. Or they are not making it interacting with children, they're not socializing, they're not communicating. So these awareness programs should be used on all media so that the mothers, fathers, the attendants, the brothers and sisters all made aware of the fact that there's something really happening to the child which is not fall under the norm of behavior and cooperation. Thank you.